Sorry, Sadie, will you say that one more time?
I said they don't want to hear me. They want to hear Keith because he is the star of the show.
That's probably one of the funniest things I've ever heard.
I'm just here as eye candy.
Or maybe Keith just wants to hear Keith. I don't know what it is.
There we go. Man, it's a rough afternoon for us.
I like to hear myself talk. That's why I'm on the radio all the time.
Oh man, I like it. You guys, we're here once again. Sadie's decided to join us again somehow. I don't know what I had to do to bribe her to get here, but I'm sure I'll pay for it later on. So Sadie, thank you for coming. We appreciate it.
It was the candy, wasn't it?
It's the candy, right? I've got the humbugs right in front of you that are delicious.
So, do you want a humbug?
Maybe after.
Everybody, you can stop by my office, and I've got a good humbug piece of candy from Maine, I believe it is. Anyways, Tramadol. That's what we're jumping into today. It's another quick one. We had a pretty heavy-hitting drug last week with ketamine. That was a long one. So we're going to have some short
So that would have been 2 weeks ago.
That's correct. 2 weeks. Now they know when we actually record, huh?
Mm-hmm. We just like jumped ahead in the future 7 days in the 5 minutes it took you to load this.
Hoorah! I like it.
Didn't even need a DeLorean.
I know.
So,
man. Well, let's jump into Tramadol and get going.
Cool. So Tramadol is an opiate, but it's a weak opiate. Oh. And we see it for pain relief, usually mild to moderate pain. Here's the cool thing, 1/10 the potency of morphine. So very weak. Onset of action of 1 hour. So it's not effective for acute or traumatic pain. This is not a drug we're going to see out of hospital or with first responders, probably ever. And here's the cool thing. It has the added ability to inhibit serotonin and norepinephrine reuptake, which means as your body secretes serotonin to make you feel good and happy, it keeps it from reuptaking, and it works very similar to antidepressants.
Okay.
So that serotonin hangs out for a longer period of time, and you're just a happier person, Zach.
All right.
So we see it prescribed to people with chronic pain. And most people with chronic pain get rather depressed. So that's where we see it. So the types of specifics we're going to see it prescribed for is fibromyalgia.
Wait, how do you just jump into the next slide and not mention these?
It was so funny. I typed in fibromyalgia animation, and that's what came up. It looked so cool. Okay. And then I typed in restless leg syndrome, and I got that one. And I was like, these are awesome. Done. And I just drew it in. And it was after I drug him in, I noticed that the one's copyrighted. So please don't sue us.
I think we just got a glimpse into how Keith's brain works, right? I typed this in, and that pulled up. So here we are.
Well,
all right. I'm sorry.
I was going to say, in getting the animations for Dilaudid, and people refer to as the D, I didn't even type that into a search. I'm just saying.
We just got to keep on going.
It probably would have returned some less than acceptable results.
Hey, so sleep aid for patients with all right.
So sleep aid, mild to moderate pain.
Great.
We see this prescribed a lot to our residents in skilled nursing facilities. And you're going to see this on med lists a whole lot. So here's your dose. Usually it's 50 milligrams, but it can go as high as 100. Max of 400 milligrams a day. So you can load quite a bit of this on in a day. And since it's so weak, there is very little risk of it becoming habit forming. And here's the cool numbers. 60 minutes, 1 hour for an onset, peaks in 2 to 3, duration of 4 to 6. So that's why it is very good as a sleep aid.
Lasts a good time. That's a long onset too.
That's
Zach's
why it's
thinking-
not good for EMS.
No.
Zach's thinking, I need to make a phone call to my doctor.
I've got, I feel like
Good
I've
stuff.
just got pins going in all over my skin, dog.
So we haven't talked about scheduling of narcotics, but this is a Schedule 4, which means it's very low down the list in priority. Schedule 1 means there's no medical benefit. Schedule 2 means there's a high risk of abuse and addiction, but there is a medical benefit. Like
Heroin would be a good one for Schedule 1.
heroin, Schedule 1.
Cocaine for Schedule 2.
And why is cocaine a Schedule 2?
I've actually been able to give cocaine.
Because nosebleed, right?
Nosebleed.
Yes.
Yeah, nosebleed.
So a lot of people don't know that it's very weak. It's
Just-
very diluted.
You
Hey,
know,
whoa. We don't
just-
need to say that. All right.
Right.
giving you some coke. Here's the question: what schedule is marijuana?
What?
No.
Schedule 1,
Yeah.
which is just
No medical benefit.
the most ridiculous thing, and that's why we have so many issues legally with marijuana. Is somewhere along the line somebody did it as Schedule 1, and there is a health benefit to marijuana, and that's why we have a lot of issues with it. Most of our controlled substances are going to be Schedule 2: ketamine, Perced, morphine, fentanyl, drugs like this. But even though there's a low likelihood of abuse, there's a high likelihood of polysubstance overdose, meaning somebody's prescribed this, their doctor's going to tell them to go off of their antidepressant meds because of the serotonin reuptake properties.
Mm-hmm.
And if they start getting depressed, they're going to say, oh, I'm going to go back. I'm going to start taking more of these. And that's where we're going to see people getting in trouble. With 911, we saw a lot of people overdosing on Tramadol, which wasn't that big of an issue, but they'd also go back because they'd usually still have some pills of their SSRIs or MAOIs, and they'd start taking those, and that's where we'd start to have issues.
Okay.
Pregnancy Category C, we're pretty used to seeing this. Most of our
Yep.
meds are Category C.
Yeah.
So contraindications. We don't want people that are on other antidepressant meds taking these. So if a person's on Tramadol, the doctor's going to be watching them very carefully on with any other antidepressants. Hypersensitivity, then you can also get respiratory depression on it. And you're going to just kind of give you a little bit of a ding, ding, ding. Again, liver function, kidney dysfunction, and taking it with any other CNS depressant is discouraged. So side effects, respiratory depression is always an issue, and we talk about this with all narcotics, but we're going to talk about serotonin syndrome again and seizures. What other med have we talked about serotonin syndrome on? I'm putting Zach on the spot.
For sake of the joke, what was the question?
No.
I just had to.
You know what? I should have
I
have written the answer down and slipped it to Sadie.
I
So when
know.
you get stumped up, she could say, "Well, I wasn't here for it,
Man.
but I believe Zofran has some serotonin
Now,
reuptake."
This is where I want to know
abilities.
if you were the kid in school that would write the wrong question on the test just to screw up the guy cheating off of you, like I'm
I
gonna be
wouldn't do
honest.
that. I wouldn't do that to Sadie though.
I
I'd give
do
her-
believe that. You
I'd
do
give
it to
her
me,
the-
but
I'd do it to you in a
Yeah.
heartbeat. And
is it Zofran?
Zofran?
Okay,
Zofran was the
I
other
had
med
forgotten
that
that.
we talked about this with. That should have been one of your gee whiz moments. Is wow, Zofran has some serotonin issues. And there's some other drugs that we've stuck in there.
Well, gee whiz, wow.
So, in fact, the slide on serotonin syndrome, I just copied and pasted it straight over from Zofran, and I just erased the Toradol.
Do we
out
get
of
to
it.
do that next?
Yeah. So respiratory depression, we've talked about this over and over again.
Yeah.
So they need ventilation, not Narcan. But then look at this. I just copied and pasted this straight over from Zofran. And then on the avoid use with patients taking SSRIs, tricyclics, MAOIs, fentanyl, lithium, buspirone, that used to say tramadol in there, but since we're talking about tramadol, I just erased it. So yeah, this is a really quick one for me to do.
Okay.
But seizures, look up there, we got seizures in red. We go to the next slide. The seizures are generally going to be by hyperthermia. And I want to talk about febrile seizures for a minute. We usually see febrile seizures in pediatrics. And it's not because of how high their temperature gets, it's because of how quickly their temperature rises, because of an immature body system and a lack of surface area in dissipating heat. So when you see seizures with tramadol, usually it's going to be because of hyperthermia, and you got to be thinking that, okay, they're having a seizure because of this, because their temperature has risen, but has risen rapidly. So you can also have the same issue if you bring the temperature down too fast, which is one of the things we talk about with febrile seizures with pediatrics. We want to slowly bring the temperature down. If we do it too rapidly, we're going to have seizures on the way back down as well. It's interesting to notice, if we look at our protocols, who can give benzodiazepines for seizure activity?
Paramedics.
Only paramedics. And EMTs and advanced, you can start getting an IV in, but you can give them some fluid, but that's where it ends with you. So the Versed is reserved for the red patches.
Just these people. Man.
Who has two thumbs and can administer Versed? This guy.
That guy.
Sometimes I just need a pat on the back.
Yeah. Does it make you feel good? Is this a good ego boost for you?
It is.
So that's all we've got with Versed. Or not Versed. Wow. I'm a little tired. I need to go home and go to bed.
That's okay.
That's all we got for tramadol. Another good, quick one. Hope you learned at least something easy. We didn't get to put Sadie on the spot. What do you want to add, Sadie?
Oh, just that I also have two thumbs and a red patch. So call me.
Hey, right there.
Two thumbs and can give Versed.
Right.
That's right.
Man.
But I don't. I'm sorry, that was not nice.
Once again, I just want to jump in and say, hey, when you're transporting with a patient that's been put on Tramadol or any other narcotic that to calm them down or help with pain, this little guy right up here, your end title, CO2, right? That's something we totally should be putting on, regardless of your certification. You don't have to have a red patch and two thumbs. You can have a green patch or a blue patch and still monitor that.
And how many of our trucks have end title CO2 capabilities?
ALL. That's
every single one of them.
Now, what's the point? Okay, I know some people out there are like, but I can't do anything. Well, no. If you're monitoring this and all of a sudden it goes into you fill it in the blank there, goes down, well, right away, like, hey, something's up. We need to be calling for ALS. And so it can be a really big red flag for you of, hey, we need to call for ALS. I've been monitoring this and it's been good up until this point. And so use the tools that we've provided for you. Go for it.
They can help you figure it out earlier too and call earlier, and then the sooner we get those going, the sooner they get better. So.
If you're starting off and hey, they've been at 39 for the whole time and it's been climbing up slowly, and you know what, their respirations have gone down slowly, and so that can be a clue to you of, hey, maybe I should start bagging this patient, getting some more movement there or whatever, right? So there you go.
Or coaching them.
Yeah, that's another big
Breathe, Zach. Breathe. Usually that works pretty good.
You know what? That's my number one go-to, and I generally don't have to do anything.
Is yelling at your patient
Great.
I mean, it depends. Yelling is relative, right? Whatever you want to say is a yell. Like, come on, Keith, come on,
you can do it.
I call it coaching. I'm a bit of an aggressive coach.
Call it
so
speaking effectively.
Aggressively.
Awesome. You guys, once again, we appreciate all the feedback we keep getting on these. Thank you for tuning in, and we hope you have a fantastic week. All right. All right.
One last cough.
Yeah, just make sure it's there.